The Department of Pathology at the University of Michigan is a patient-centered department that's dedicated to the continual improvement of the quality and safety of patient care. Two of the most important initiatives for the Department of Pathology are to be a leader in the nation in biomarker discovery and to accelerate the application of sequencing-based diagnostics to clinical care. And the way that we're doing this is through the Michigan Center for Translational Pathology, which leads our efforts in biomarker discovery, and our molecular diagnostics work, which is provided through our MLabs reference laboratory program.
The mission of the Michigan Center for Translational Pathology is really translating discoveries that are made through high-throughput approaches such as genomics, proteomics, and metabolomics, and translating that into a clinical practice in terms of new diagnostics, as well as developing novel therapeutics. The flagship project of the Michigan Center for Translational Pathology is called MIONCOSEQ, which stands for the Michigan Oncology Sequencing Project. Essentially what we do is we enroll patients with advanced cancer or metastatic disease, and we interrogate their tumors in a comprehensive fashion using next-generation sequencing or massively parallel sequencing to comprehensively define the mutational landscape of tumors compared to their matched normal genome. These results are then presented to a multi-disciplinary sequencing tumor board, one of its first of its kind that we've established in the country, that then deliberates on these findings and then conveys these findings back to the treating oncologist as well as to the physician.
It takes a wide range of people to do the kind of work in the MIONCOSEQ project. It involves oncologists and pathologists and radiologists and bioinformatics scientists and even clinical genetic counselors. And this is why it's so important to be patient-focused, because if you're patient-focused, you'll do the right thing and find ways of getting a variety of faculty in different departments to work together in order to do what's right for the patient.
Our ultimate goal is to basically match drugs appropriately to an individual patient. So sort of moving towards personalized medicine, or in other words, some people call it precision medicine, basically trying to devise the precise therapy for an individual patient.
One of the most important areas in our department is our MLabs program.
MLabs is really an administrative or business unit in the Department of Pathology. It functions as a portal to provide access to the combined experience and expertise of our staff and faculty.
MLabs is reflective of what's known around here as the Michigan difference. People go out of their way to ensure that the quality of care that's delivered is delivered at the highest level.
MLabs provides access to expertise and consultation around a broad menu of esoteric tests, including molecular tests that are so important in this age of personalized medicine. But it's more than that. Because we link that to experience and expertise, we help you know the right test, we help you understand what the result means, and we help you know what it doesn't mean. And we do that in part through a customer service portal that's absolutely dedicated to meeting the needs of all of those we serve.
The area of biggest growth for us has been in molecular diagnostics, where we've seen a 1,300% growth in our molecular testing over the past 5 years.
We have chosen to focus in molecular oncology since it's been demonstrated that recurrent genetic alterations characterize many forms of human cancers. As a result, the diagnostic criteria for determining that a cancer is a specific form of cancer can be obtained using molecular means. In addition to that, molecular profiles determine the prognosis and, importantly, the treatment of specific forms of cancer.
MLabs is changing the healthcare industry. We have the best trained medical and scientific personnel in the world. And when you bundle that with the best customer service, that is an unbeatable combination. That's how we're setting the bar and setting the gold standard of the healthcare industry right now.
We understand that personalized medicine is more than just DNA. It's helping patients make big decisions based on the information that we provide. And we think we're in the best position to help them understand that information.
we're pretty clear about where we want to be. We want to lead the nation in biomarker discovery and in bringing sequencing-based diagnostics to routine clinical care. We are looking forward to moving into a state-of-the-art facility that'll house all of the clinical laboratories, and we remain committed to training the future leaders in academic pathology.